Hello, everyone, and welcome to Mackenzie Health's Community Telephone Town Hall. We are live tonight with Mary-Agnes Wilson, Interim President and CEO of Mackenzie Health, and members of Mackenzie Health's Executive Leadership Team. In addition, we are joined by thousands of residents from Vaughan, King, Richmond Hill, and surrounding communities listening in. To submit a question tonight, simply press 3 on your phone's keypad. Once again, press 3 to submit a question at any time. My name is Eric, and I'll be moderating the town hall this evening. During this live community telephone town hall, we encourage you to get involved and to ask questions and give your opinion by voting on a few survey questions we have for you. Mackenzie Health chose this format as it is an interactive town hall with you, which means they want to hear from you. Mary-Agnes and Mackenzie Health's executive leadership team want to hear your feedback and opinions and have an open dialogue and discussion with you and other residents as we plan for the future of healthcare in our community. Tonight, we want to share some updates about hospital operations, recent achievements, current challenges, tips to protect yourself and loved ones during respiratory virus season, and more. Our intention is to get as many questions from you as possible. You can submit questions at any time by pressing 3 on your phone's keypad. Someone will take your name, where you're calling from, and your question. Now, for those of you just joining us, hello and welcome to Mackenzie Health Community Telephone Town Hall. We are live tonight with Mary-Agnes Wilson, Interim President and CEO of Mackenzie Health, and members of Mackenzie Health's Executive Leadership Team. In addition, we are joined by thousands of residents from Vaughan, King, Richmond Hill, and surrounding communities listening in. Once again, we want to remind everyone tonight you can submit a question at any time by pressing 3 on your phone's keypad. We also have a few survey questions that we're going to ask you this evening. You'll have a chance to vote live on your phone's keypad as those questions come up. Now, due to the high volume of callers joining us today, individuals will be joining it at various moments throughout the town hall. Mackenzie Health will be posting a full recording to their website in the coming days for those who missed some or all of today's event. The agenda for today's town hall will include updates from Mackenzie Health leaders, polling questions in between the updates, and opportunities for callers to ask questions and share their comments starting at around 7:30 p.m. So let's get started. First, we're going to hear from Mary-Agnes Wilson, Interim President and CEO of Mackenzie Health. Mary-Agnes, over to you.
Thank you, Eric, and good evening, everyone. Welcome to our annual Telephone Town Hall. We're looking forward to this opportunity to speak to residents across Western New York region and hear from you this evening. I'd like to begin with our land acknowledgement. Mackenzie Health is situated on treaty lands that have been lived on and cared for by generations of the Mississaugas of the Credit. It is the traditional territory of other First Nations, including the Haudenosaunee and the Wendat. This land is currently home to many First Nations, Métis, and Inuit people today. Mackenzie Health is grateful for the opportunity to deliver essential care to patients in this territory. I'm glad to welcome you to this year's Telephone Town Hall. We host these calls at least once a year because we want to have an important conversation with you, our community. We hope tonight's town hall will complement the information we share with you throughout the year on our website, social media channels, and through our regular newsletters. While I've joined you at town halls for a number of years in my previous capacity as Executive Vice President, Chief Operating Officer, and Chief Nurse Executive, tonight is the first time I've participated in a conversation with our community since taking on the role of Interim President and CEO earlier this year. And I'm really glad to be here with you for the next hour or so. I'm looking forward to connecting with you and answering your questions. And tonight, I'm also joined by a few of my colleagues. With me is Dr. Stephen Jackson, Vice President, Medical Planning and Chief of Staff, David Stolte, Executive Vice President, Strategy and Clinical Support, and Heather Stewart, Interim Executive Vice President, Clinical Services and Chief Nurse Executive. Our community is at the heart of everything we do, and we'll be sharing how we're adapting, investing, and planning for the future to make sure everyone who calls this region home continues to have access to the care they deserve. We'll also be answering your questions live and asking for your input throughout a few polling questions. Before we begin, we'd like to ask you our first question. Eric, can we start with the first polling question?
Of course. So our first polling question is going to come up right now. You can use your touch-tone phone to indicate your response. We want to know, when you or a loved one receive care at the hospital, what matters most to you about the experience? If it is clear communication from staff about what's happening and what you can expect next, please press 1. If it is feeling listened to and treated with compassion, press 2. If it is quick access to the care you need, press 3. If it is knowing that an expert clinician is responsible for your care, press 4. If it is a comfortable and safe environment, press 5. If you use walk-in clinics, press 6. And if it is another reason, press 7. So again, when you or a loved one receive care at the hospital, what matters most to you about the experience? If it is clear communication from staff about what's happening and what you can expect next, please press 1. If it is feeling listened to and treated with compassion, press 2. If it is quick access to the care you need, press 3. If it is knowing that an expert clinician is responsible for your care, press 4. If it is a comfortable and safe environment, press 5. If you use walk-in clinics, press 6. And if it is another reason, press 7. Mary-Agnes, back to you.
Thank you. Mackenzie Health is proud to serve the communities of Richmond Hill, Vaughan, and King through 2 full-service hospitals, Mackenzie Richmond Hill Hospital and the Cordalucci Vaughan Hospital, as well as a network of community-based locations. We are your go-to healthcare provider in Western York Region, and together our hospitals lead several well-known regional programs. These include the provincially recognized Sorbera Integrated Stroke Unit, which is part of the Sorbera District Stroke Centre for York Region. We also lead the York Region Chronic Kidney Disease Program and the Domestic Abuse and Sexual Assault Care Centre of York Region, also known as DASA. And residents across Richmond Hill, Vaughan, and King can trust that no matter which of our 2 hospitals you visit, you will receive safe, quality care from our expert clinical team. We also support a number of programs outside our hospital walls to ensure residents get the care they need once they no longer need to be cared for in our hospitals. Our home care program, Mackenzie Health, connects patients and families with resources and support, helping with navigation, education, and access to services so that care continues at home and in the community. We also support a transitional care unit at Richview Manor, a nearby retirement home that offers a dedicated space for patients who no longer need acute hospital care, but who aren't ready to return home. This provides them rehabilitation and recovery support in a safe and comfortable environment. Some people may not be as familiar with our community-based locations, which provide a number of services including urgent care, behavioral health, which includes autism services and supports for those with cognitive or developmental challenges, chronic kidney disease, diabetes education, domestic abuse and sexual assault care, mental health, and a reactivation care center to help patients who are medically stable and ready to leave the hospital but still need some support before moving to their next care setting, like home, rehab, or long-term care. This past year, we've also expanded and introduced a few new programs and partnerships, and I'll share 4 examples with you today. The first example I'm proud to share is that Mackenzie Health joined the Princess Margaret Cancer Care Network this past March. Over the past few years, our oncology clinic has grown by nearly 30%, now caring for close to 100 patients every day through consultations, follow-up, infusion treatments, and vital patient education. This growth shows how important it is for residents to have access to comprehensive cancer care without having to travel far from home. The Princess Margaret Cancer Care Network is a collaboration of local, regional, and national partners committed to advancing cancer care. And by joining this network, we will strengthen access to quality cancer care close to home in a number of ways. We're expanding access to clinical trials for our patients, strengthening our cancer survivorship programs, enhancing patient education and resources, and helping to develop the next generation of oncology specialists right here in our community. Princess Margaret is one of the top cancer centers in the world, and Mackenzie Health is now one of just 7 hospitals in Canada to be part of this network, a milestone that reflects the exceptional work of our oncology team. The second example I want to share about our program growth is a new partnership we recently announced with Southlake Health, and it's to expand access to advanced cardiac care in York Region. This partnership will allow us to develop an advanced cardiac center at Mackenzie Health through a multi-year phased approach. As our regional cardiac program, Southlake will support us with education and training for our staff and physicians. Our cardiologists are already experts in their field, and this additional training will allow us to better support our patients by delivering more advanced procedures right here in our hospitals. The first step in this expansion will be the opening of pacemaker follow-up clinic at the Mackenzie Richmond Hill Hospital that will be opening on December the 2nd. Hundreds of people will now be able to have their follow-up appointments right here in York Region without having to travel outside of our community. This is an exciting step for both our patients and our team, and we're really glad to be moving forward together. Another example I want to share is how we're using technology and our digital health expertise to improve care, not just here in York Region, but across Ontario. Through MyChart, patients can securely access their health information online, from test results and appointment details to visit summaries, anytime, anywhere. This is powered by our advanced electronic medical record system, which connects care across both hospitals and our community locations, ensuring your health information follows you wherever you go within Mackenzie Health. More than 375,000 people have enrolled in MyChart at Mackenzie Health and have taken control of their own healthcare information. And we're proud to share that we're helping other healthcare organizations benefit from this expertise too. For example, we've partnered with Casey House in Toronto, Canada's only hospital dedicated to HIV care, to support their transition to a modern EMR system. These collaborations mean better, safer, and more connected care for patients across the province, and they position Mackenzie Health as a leader in digital health innovation. And the final example I'll share today is that we fully opened our inpatient mental health unit at the Mackenzie Richmond Hill Hospital this past July, adding 20 additional beds to the healthcare system. Mental health challenges touch every family, and we believe mental health care should be close, compassionate, and available when our community needs it. We now have 52 mental health beds across both of our hospital sites, and we're able to support 60% more patients who needed inpatient mental health care. If you have the opportunity and the means to support the mental health program at Mackenzie Health, our foundation has launched the Together We Shine Brightest campaign to help raise funds for this important program. Supporting mental health is just one of the many ways we're working to meet the diverse needs of our community. At Mackenzie Health, our two hospitals, Mackenzie Richmond Hill Hospital and Courtleach Vaughan Hospital, we work together to deliver seamless care across Western York Region and beyond. Whether it's through specialized programs or core services, our physicians and care teams work across both sites and our community locations to ensure patients get the right care in the right place at the right time. The reality is, both of our hospitals are very busy, and we're seeing record numbers of people coming to us for care. Last year, we had more than 241,000 visits to our emergency departments and urgent care sector. That is more than double what was projected before we opened our second hospital just 4 years ago. And this month, on average, we've been seeing more than 700 patients every single day in our emergency departments. Mackenzie Health now has the second busiest emergency department volumes in Ontario, and we're consistently seeing more patients who need to be admitted than we have available beds. And wait times are longer than we would like. Please know our teams continue to do their best every day. We thank you for your patience and cooperation as we continuously adjust to meet our community's needs. Eric, over to you for the second polling question.
Of course. So again, we have another polling question. I also want to quickly remind everyone that we want to hear from you this evening. You can submit questions at any time by pressing 3 on your phone's keypad at any time during the town hall this evening. Someone will take your name, where you're calling from, and your question. So again, submit questions at any time by pressing 3 on your phone's keypad. Now we're going to do a survey question. So using your phone right now, you'll have a chance to vote or offer your answer on the following question. We want to hear from you. We know how stressful it can be waiting in a busy emergency department. When wait times are longer than expected, what would make the experience better for you or your loved ones? If it is more frequent updates about expected wait times, for example, a clock displaying the wait time, please press 1. If it is better communication about why there's a long wait, press 2. If it is information about other care options, such as urgent care or virtual care, press 3. If it is support from staff or volunteers while waiting, press 4. So again, we know how stressful it can be in waiting in a busy emergency department. When wait times are longer than expected, what would make the experience better for you or your loved ones? If it is more frequent updates about expected wait times, for example, a clock displaying the wait time, please press 1. If it is better communication about why there's a long wait, press 2. If it is information about other care options, like urgent care or virtual care, press 3. If it is support from staff or volunteers while waiting, press 4. Mary-Agnes, back to you.
Thank you, Eric. So before we jump back into some operational updates, I do want to take a moment to acknowledge some leadership changes at Mackenzie Health. This summer, Altaf Stationwala moved onto an exciting new opportunity at Unity Health after more than 14 years with us. Under his leadership, Mackenzie Health became the forward-thinking regional healthcare provider it is today. And Altaf remains a resident of our community, so if he's listening in, on behalf of all of us, thank you, Altaf, for your many contributions and years of service. I've stepped into the role of Interim President and CEO while our board continues its search for a permanent successor. They're making good progress and hope to share news with you soon. We're also preparing for a few other leadership transitions. Dr. Stephen Jackson, who's with us tonight, his term as Chief of Staff is coming to an end soon. Stephen has guided our physicians through some truly unprecedented times, from global pandemic to opening a brand new hospital. Stephen, thank you for your leadership and everything you've done for our community. We're excited to share that Dr. David Rochewerker has been selected to take on the Chief of Staff role effective December 15th, 2025. Members of our community might recognize Dr. Rochewerker for his leadership during the pandemic as our Chief and Medical Director of the Emergency Department, a role he held for over a decade. David brings the expertise needed to guide our organization as we chart the next chapter of growth and innovation. And Heather Stewart has also taken on the interim role of Executive Vice President of Clinical Services and Chief Nurse Executive, filling the position I previously held. Once a permanent President and CEO is in place, we'll be recruiting for that role as well. So even though we're in a period of transition, I want to assure the community that is business as usual. Whether you visit one of our hospitals or one of our locations in the community, you'll continue to receive the care that you need. We are committed to having the right people in place to lead us into our next chapter, and we'll keep you updated as things progress. But as we navigate these leadership changes, our focus remains on the future. That's why I'd like to take a few minutes to share how we're preparing for what's next through our updated strategic plan called Delivering Today and Building for Tomorrow. Even as we manage the daily challenges of healthcare, we're reminded why it's so important to keep looking ahead. And this new plan builds on the strong foundation of our 22-25 strategy, and it sets the direction for how we'll continue to grow and improve care for our community. We're building a modern, connected hospital network for the future. Driven by our community's unique needs, we envision a system where teaching, innovation, safety, quality, and patient experience come together, powered by a skilled and compassionate workforce and the relentless pursuit of care excellence. It reflects not just the perspectives of our staff and physicians, but also what we heard from many of you through patient surveys, community conversations, and feedback to our patient experience team. So thank you for helping to shape this important work. This plan sets out how we'll deliver the safe, compassionate, high-quality care you expect today while preparing for our future. And here's what it means for you. More care close to home. As one of Ontario's fastest-growing regions, we're expanding services and infrastructure to meet your needs. Exceptional care every time. Patient care excellence is at the heart of our plan, with safety, compassion, and quality guiding everything we do. People who care for you. We're investing in a skilled, diverse, and inclusive workforce so our teams can thrive and provide their best care. And a seamless experience. By strengthening partnerships, we're building a more connected health system that makes it easier for you to access care. And finally, innovation that matters. By supporting education and research, we're finding new ways to help you get better, stay healthier, and enjoy a stronger quality of life. Our partnership with York University's new School of Medicine will be a big part of that last priority. The medical school is set to open next to the Cordelucci-Vaughan Hospital in 2028. We're also expanding our research program to bring new treatments and new innovations to our community, so patients have access to the best possible care right here at home. As I mentioned earlier, our emergency department continues to be one of the busiest in the province. In fact, we saw higher volumes much sooner than anyone expected when Cordelucci-Vaughan Hospital opened. And the numbers really do tell the story. People across Western York Region count on their local hospitals for care, and you're coming to us in record numbers. Both of our hospitals are operating at or over capacity every single day, and that demand is only going to continue to grow. Our community is expanding rapidly, and in another 15 years, we're expecting about 250,000 more residents. Now that's more than the population of Richmond Hill today. With aging infrastructure at Mackenzie Richmond Hill Hospital, new housing developments, and the subway extension coming to Richmond Hill, now is the time to plan for the future healthcare needs of our growing community. At our last telephone town hall, we told you about the Mackenzie Health Cares campaign, launched to connect with you, our community, and advocate for the resources and infrastructure we need to keep pace with this growth. We're continuing to work closely with government partners to make sure your voices and needs are heard. A little later this evening, you'll hear from David Stolte, our Executive Vice President of Strategy and Clinical Support. He'll share more about what we've heard from you so far and how you can continue to help shape the future of healthcare right here in our community. But first, let's go to our next polling question.
And here is our next polling question. So again, using your touchtone phone, you can indicate your response on this question. About 70% of the people coming to us for care are seniors. For the seniors on the call and for their loved ones who help care for them, what matters most to you from your local hospital? While each of the following plays an important role, which is the most important to you? If it is wait times for assessments, press 1. If it is better coordination between the hospital, family doctors, caregivers, and community services, press 2. If it is staff trained in specialized care for older patients, press 3. If it is making sure our spaces and our care meet the needs of older adults and making them feel comfortable, respected, and understood, press 4. So again, about 70% of the people coming to us for care are seniors. For the seniors on the call and for their loved ones who help care for them, what matters most to you from your local hospital? While each of the following plays an important role, which is the most important to you? If it is wait times for assessments, press 1. If it is better coordination between the hospital, family doctors, caregivers, and community services, press 2. If it is staff trained in specialized care for older patients, press 3. If it is making sure our spaces and our care meet the needs of older adults and making them feel comfortable, respected, and understood, press 4. And we also want to remind listeners that due to the high volume of callers joining us today, individuals will be joining us at various moments throughout our town hall. Mackenzie Health will be posting a full recording to their website in the coming days for those who missed some or all of today's event. I also want to let everyone know how they can ask a question at any time by pressing 3 on your phone's keypad. So if you'd like to submit a question, press 3 on your phone's keypad at any time. Someone will take your name, where you're calling from, and your question. So again, just a quick reminder, press 3 on your phone's keypad to submit a question. For those who are joining us now, members of Mackenzie Health's leadership team have already provided an overview of the programs, services, and current state of operations at Mackenzie Health, an update on leadership changes at the organization, and information about their newly launched strategic plan. Now let's welcome Heather Stewart, Interim Executive Vice President, Clinical Services and Chief Nurse Executive, to provide some updates about what's happening in the emergency department and across both hospitals. After that, Dr. Stephen Jackson, Chief of Staff, will provide an update about Mackenzie Health's excellent surgical program and what the hospital is doing to ensure people have access to timely surgical services. Heather, over to you.
Thank you, Eric. It's a pleasure to connect with all of you this evening. I'm so proud of the work our doctors, nurses, and all the staff at Mackenzie Health who provide care for our community. Mary-Agnes has already mentioned how busy our emergency departments are at both hospitals. It's true, we have the second busiest emergency department in Ontario. We regularly see between 600 to 700 patients across both our hospitals and our urgent care center every day. With fall here, our teams are preparing for the months ahead when we typically see more patients with respiratory illnesses like colds, the flu, and COVID-19. In September, we are already seeing an increase in patients with pneumonia and upper respiratory tract infections. Both our emergency departments and the urgent care center are seeing more patients now to this time last year, and these volumes have become our new norm. We are operating over capacity, and many of our people coming to us for care are very sick and need to be admitted. We're doing our best to triage patients as quickly as possible, but lately the wait times are longer than any of us would want. Sometimes patients might also need medical imaging scans or blood work that gets sent to the lab. These take time and may contribute to what feels like an even longer wait time. When beds aren't available on our inpatient units, patients may receive their care in the emergency departments until a bed becomes available. This is not the experience we want for our patients, but our priority is to get people the care they need as soon as possible. On really challenging days, we're so full that more than 80 people who come through our emergency departments need to be admitted, but have to wait for a hospital bed to open up. At our last peak year volume, we had more than 100 patients waiting for a bed to become available. We are so full, we had to make preparations to retrofit our auditorium at the Cordelucci Vaughan Hospital to become a surge space where we could care for patients. We're already seeing signs that the usual fall increase in number of patients seeking care arrived earlier than expected. This just shows how important it is to stay ahead with smart planning. Thanks to the incredible collaboration across teams, we have strong plans in place to manage through another difficult respiratory virus season. There are also more patients arriving sicker who need to be admitted to the hospital. Our inpatient units operate over capacity most days. This means we've created additional spaces for the overflow of patients needing care at both hospitals. We're doing everything we can to ensure that patients who need care on an inpatient unit get the care they need, even if it might be in an unconventional space. As much as we make effort to move patients out of the emergency department quickly, sometimes that's not possible, and patients may need to spend an extended amount of time in the emergency department before a bed can become available. In addition to the extra spaces we've made available at the hospital to act as overflow areas where needed, we've also implemented new strategies to support faster admissions from the emergency department to inpatient beds. For example, in April of this year, we converted some lounges in our medicine units to give patients a comfortable place to wait to be picked up once they're ready to go home. This frees up beds sooner for patients in our emergency department for beds and improves patient flow, helping reduce hallway medicine. With respiratory virus season picking up and the holidays around the corner, we're working with our partners across the region to ensure we have the resources we'll need to support our community through another busy season. Before I hand things over to Dr. Jackson, there's one more important message I wanted to share. We've talked tonight about the pressures we're facing with high volumes, longer wait times, and we know that can be frustrating. We hear you, and we're always looking for ways to make the care experience better. But since the pandemic, we've seen a troubling increase in aggressive and violent behavior towards our staff, physicians, and volunteers. And while we understand emotions can run high, this behavior is never acceptable under any circumstances. Our team is here to care for you and your loved ones, and they deserve to do that in a safe, respectful environment. So we're asking for your partnership. Please be kind, patient, and considerate. If you need any additional support or information during your hospital visit, please reach out to your care team. At Mackenzie Health, we're committed to providing high-quality care and a safe and inclusive space for everyone, and we will not tolerate physical or verbal abuse. Together, we can make sure our hospitals remain places of healing and compassion for you, your family, and our entire community. Thank you for helping us keep our care safe, respectful for all. Now I'd like to pass it over to Dr. Jackson, our Chief of Staff and Vice President of Medical Planning, to provide some updates about our surgical program and how you can stay safe this respiratory virus season.
Thanks, Heather. Before I begin my updates, I'd just like to say that it's been an incredible privilege to serve this community for the past 12 and a half years as Chief of Staff at Mackenzie Health. Every decision we made was guided by one goal: making sure people in Western York region have access to the best possible care close to home. Leading through a global pandemic and opening a second hospital during a pandemic were challenges none of us could have imagined. But what stands out most is how our teams and our community came together to support one another during those times. I'm proud of the progress we've made, not just in expanding services, but in building a health system that reflects the needs and values of the people we serve. As I step away from this role in the coming weeks, I'm excited for what's ahead. Our community is growing, and Mackenzie Health is well positioned to keep innovating and delivering exceptional care for generations to come. As we head into winter, we know respiratory illnesses are already affecting many people in our community, and we expect things to peak in January. Our goal is to make sure we're ready to care for everyone who needs us during what's often the busiest time of the year. That's why it's so important to take steps now to protect yourself and those around you from viruses like the flu, COVID-19, and RSV. One of the most effective ways to do that is through vaccination. Flu and COVID-19 vaccines are available through your family doctor, local pharmacies, and York Region public health clinics. For infants born this year and high-risk children under the age of 2, RSV immunization is also available through public health or your physician. Babies born in Mackenzie Health during RSV season may be eligible to receive the vaccine right after birth. Please speak with your care provider to learn more. RSV can also pose a risk to older adults. All individuals aged 75 years and older are now eligible for the RSV vaccine, though some over the age of 60 may qualify as well. We encourage you to check with your own family doctor. Beyond vaccination, there are other simple but powerful ways to stay healthy this winter. First and foremost, avoid spreading germs. At Mackenzie Health, we've reintroduced a requirement to wear masks when staff are providing direct patient care and in the most high-risk areas of our hospitals. Masks are now required for everyone in our chemotherapy clinic, in our dialysis units, and in any units experiencing an outbreak. We also strongly recommend that visitors wear masks in patient rooms and waiting areas. We appreciate your cooperation in helping us protect our most vulnerable patients. We'll keep an eye on how respiratory illness season unfolds, and as things tend to settle down in the spring, we'll take another look at our masking guidelines. Hand hygiene is another key defense. Please remember to wash your hands frequently, and if you do become ill, staying home and avoiding contact with seniors, young children, and those with compromised immune systems is the best way to recover and prevent further spread. Taking care of yourself helps protect others too. Now I'd like to share an update on our surgical program, one of the many ways we're helping people in our community get the care they need close to home. We know how stressful it can be to wait for surgery, especially when you're in pain or your health is at risk. That's why we've been working hard to not only reduce the backlog caused by the pandemic, but also to expand access to high-quality surgical care. Over the past year, we've made real progress. At our most challenging point, nearly 4,000 people were waiting for surgery at Mackenzie Health. Today, that number has dropped to nearly half that. That's a big step forward, and it means more people are getting the care they need faster. We're also seeing improvements in urgent care. Most patients who come to us needing urgent surgery receive it within 48 hours. That's better than the provincial average, and it speaks to the dedication and skill of our surgical teams. But our story isn't just about catching up. It's about moving forward. Each year, we perform thousands of procedures across a wide range of specialties. From hip and knee replacements to minimally invasive urologic and vascular procedures, our teams are delivering advanced care right here in our community. And when we say vascular, we're talking about things like treating blocked arteries or poor circulation in the legs. These are conditions that can be serious but are manageable with the right care. And you don't need to travel downtown for that. In fact, our vascular program was recently designated as a Level 3 vascular program, meaning we meet high provincial standards for specialized care. We're proud of our surgeons, nurses, and staff who make this possible. Their expertise and teamwork are helping us open up more time and space in our operating rooms so we can care for even more people right here at home. Now I think we're ready to take some of your questions. Over to you, Eric.
Of course, and we have our first questions coming in. I just also want to quickly remind everyone how they can submit a question at any time by simply pressing 3 on your phone's keypad. Someone will take your name, where you're calling from, and your question. So again, if you'd like to ask a live question, we'd like to hear from you. Simply press 3 on your phone's keypad, and you'll have a chance to submit a question. We'll take your name and where your question, where you're calling from, and your question. Now, for those who may just be joining us, members of Mackenzie Health's leadership team have already provided an overview of the programs, services, and current state of operations at Mackenzie Health, including an update on current emergency department volumes, planning for respiratory virus season, how Mackenzie Health is addressing the surgical backlog to ensure patients get their procedures done as soon as possible, and Mackenzie's Health plans for the future. If you'd like to listen to a recording of the full telephone town hall, please check the Mackenzie Health website next week. We are now going to get to some questions from the community. After that, we'll welcome David Stolte, Executive Vice President of Strategy and Clinical Support. So we'll now go to our first couple questions and comments from one of our callers. We had a couple questions very similar, Nelson and John. Nelson's question was, why are so many people using the emergency facilities? And John's question was, the emergency rooms are overcrowded. What is Mackenzie Health doing to address the current issues and future growth of the community?
Thank you for those questions. So our emergency department, as I said, is the second busiest emergency department in the province. I will say that from the time that we were pre-planning the opening of the Corlew-Chivon Hospital, there was lots of conversation and debate in terms of how many people we could expect to see. Remind our listeners that Corlew-Chivon Hospital was the first net new freestanding hospital in the province in over 30 years. And so the ability to accurately predict what that volume would look like was not as skillful as we would have liked. I will say that we have seen year-over-year growth, some of it because we've recaptured people who were living in this region and did not have access to local care. Some of it because we continue to see growing population. We see an aging population, and we see a population that's getting sicker over time. We regularly look at the kinds of people who come to our emergency department to make sure that we understand why they're accessing emergency care. And I will say that for the most part, the people who come to us do come because they truly need emergency care. There is a percentage of the population who come to us because they don't have access to primary care. And so what we've done to help those people is that we have set up our Family Health Navigation Clinic in Western York Region. That clinic provides primary care support for people who come to our emergency department and do not have a primary care physician. And then we try to connect those people to a permanent primary care provider. So we're having good success with that program, but that's not an answer. The answer for York Region is really to grow our primary care network, support our current providers of primary care in our region, to be more connected to hospital resources and more connected to specialized services. And we're working collaboratively with our Western York Region Ontario Health team to achieve those outcomes.
Thank you very much, Nelson and John, for your questions. We have another question coming up now, and I want to also remind everyone how you can simply submit a question by pressing 3 on your phone's keypad at any time during the town hall. Someone will take your name, where you're calling from, and your question. So again, press 3 on your phone's keypad if you'd like to submit a question. We have another question now. It's Connie. Connie asks, my nieces, who are in their 30s, cannot find a gynecologist anywhere. Where do we begin to go next?
Thank you for your question. I'm going to hand that one over to Dr. Jackson.
Yeah, thanks for that question. That's a really tough problem that we're trying to face across the whole province. There is a real long wait in most hospitals and most communities to access gynecology care. We've increased the number of obstetrician gynecologists at the hospital over the past many years, and the demand keeps growing beyond everything that we can supply. As you've heard, we have more patients coming into the emergency department. We have more patients being referred to our specialty clinics, and we're continuing to increase the capacity and hiring new people. We're actually in the midst of hiring another new gynecologist with specialty training in that area so that we can try to address some of the incredibly increasing demand for those services. So there's no good answer. There's no quick explanation as to why, but we're continuing to do everything we can to provide those services. Of course, it's always understood that in an emergency, there's always the ability to access the emergency department where you will have access to urgent and emergent care. But for now, just stay tuned, and we're doing everything we can to increase our capacity. Thanks, Eric.
Connie, thank you again for that question. And just a reminder to everyone joining us, press 3 on your phone's keypad if you'd like to submit a question. Someone will take your name and where you're calling from and your question. We're going to go now to Jennifer. Jennifer's question is, I have a pacemaker and have to travel from Woodbridge to Brampton just to get it checked. I believe there will be a facility in Woodbridge that can help. When will this happen?
Thank you for the question. So we are opening a pacemaker follow-up clinic on December the 2nd. And we will be able to actually provide care for you so that you do not have to travel to Brampton any longer. So I would suggest that you look on our website and mackenziehealth.ca to access information about that clinic.
Jennifer, thank you very much. Perfect. And Jennifer, thank you very much for that question. Again, a reminder, press 3 on your phone's keypad if you'd like to submit a question to the panel this evening. We're going to go now to a question from Robert. Robert's question is as follows. I would like to know what is being done to help senior patients that visit the ER, especially those that are suffering from Alzheimer's. They often require more help getting registered and going through the process.
Thank you for that question. I'm going to ask Heather Stewart to talk a little bit about our senior strategy and what we're doing specifically to address seniors in our organization.
Yeah, thank you, Robert. What a great question. At Mackenzie Health, we've just refreshed our senior strategy, looking at our entire organization and how we can meet the needs of our growing population, specifically our seniors. This would include senior-friendly lighting, convenient access, tools that make it easier for them to register, having our volunteers available to help our seniors move throughout the organization. So hopefully these strategies will come into good use for those in the community that come and access our hospital. But thank you for your question.
Robert, thank you again for that question. If you have a question you'd like to submit to the panel this evening, simply press 3 on your phone's keypad. Someone will take your name, where you're calling from, and your question. So we're going to go to another question. This one came in from Peter. Peter's question is, why is there no coordination through different locations?
Sorry, Eric, can you please repeat the question?
Of course. Peter's question is, why is there no coordination through different locations?
So, Eric, I'm struggling to understand sort of what is meant by coordination. We certainly have, as I said, 2 hospitals. They work in tandem. Patients can be seen at any one of those hospitals, depending on the hospital they arrive at and the services that we provide at each hospital. They're not exactly duplicate. We have core services at each organization in terms of, emergency medicine, surgery, ICU, those kinds of services, but there is some specialization, and so from time to time, patients who, for example, come to the Coeur d'Alene Hospital but need a follow-up outpatient appointment would be directed to the Mackenzie Richmond Hill Hospital, because that's where the bulk of our ambulatory care occurs. So not really sure what is meant by coordination, but just to say that we do the best to inform our patients and help them understand where care is being delivered and the locations in which that care is being provided. From an information management perspective, certainly our patient care records are accessible regardless of which location care is being delivered. So hope that helps answer the question, and happy to take the next one.
Peter, thank you for that question. We do have another question coming up now. Again, just another quick reminder, you can submit questions at any time by pressing 3 on your phone's keypad. So the next question is from Nikki. Nikki's question is Nikki would like to know what is being done to increase the number of doctors in the ER. And Nikki says we should have more than 1 or 2 that are covering the ER.
Thank you for that question. I'm going to ask Dr. Jackson to speak to that.
Yeah, thanks, Nikki. We've increased the number of physicians in the emergency department continuously, and the demand continues to go up. As we've heard, the emergency department is seeing more patients than we ever anticipated. Right now, there are many physicians at any one time. In the busiest times during the evening, there could be 7 or 8 physicians that are actually on shift. They are scattered throughout the different regions in the emergency department, and the emergency department is quite large at both of our hospital sites, and so it may look like there's only 1 physician at any one time, but there are actually many looking after the multitude of patients that are being seen and being treated there. Saying that, we are planning and is already scheduled to increase the number of physicians during the holiday period, when the time and the number of patients really increases due to the shortage of family care and family medicine doctors that are available over the holidays. So we expect a big surge over the holidays, and we've ramped up with increasing physicians and increasing the hours at the urgent care center as well. So we're doing everything we can to increase the number of physicians so you can be seen in the appropriate time and get treated as quickly as possible. Eric?
Nikki, thank you very much for that question. And I want to just take a quick moment to remind everyone that if you would like to listen to a recording of the full telephone town hall, please check Mackenzie Health's website next week. It should be available there. We are taking your questions. We want to hear from you. Press 3 on your phone's keypad if you'd like to submit a question. Someone will take your name, where you're calling from, and your question. So again, press 3 on your phone's keypad if you'd like to submit a question. We have Mary. Mary's question is as follows. Mary says, with the growing population, what is the hospital doing to increase the amount of family doctors? The list online, they seem to be not taking patients.
And thank you for that question. So, again, we're working collaboratively with our Western York Region Ontario Family Health Team and the Primary Care Network of family physicians that are currently working in the community to support them to be able to see more patients. And so, as I said earlier, we do have a family health navigation clinic here at Mackenzie Richmond Hill, or Mackenzie Health. It's at the Richmond Hill site. The reason that we started that clinic is because we saw a large number of patients come to our emergency department who did not have family doctors. And so that clinic is designed to help care for them for a period of time after they visited Emerge. It's not there to roster them permanently, but it is there to help transition them to primary care providers who may have some additional capacity in the region. In addition to that, we're working with our community partners to help them stand up some additional primary care clinics. So the government has invested in primary care, and in our region, we have 3 new clinics that will be opening up in the next calendar year after 2026. And so they'll be creating more capacity for those patients. And then lastly, we're collaborating with York University as they stand up their medical school, and their main mission is to provide training and education to increase more family doctors in the system. And so we are going to be working very closely with them as one of their lead partners. The medical school is going to be located on the Vaughan Healthcare Precinct, right beside the Coeur d'Alene Vaughan Hospital, and we're really looking forward to being able to train the next generation of doctors to really help the situation that we're facing today.
Mary, thank you very much for that question. Now, we are still having some new people joining the event. I want to welcome everyone to Mackenzie Health's Community Telephone Town Hall. We're live tonight with Mary-Agnes Wilson, Interim President and CEO of Mackenzie Health, and members of Mackenzie Health's Executive Leadership Team. We're taking questions from the audience. Simply press 3 on your phone's keypad at any time during the town hall this evening to submit a question. So once again, press 3 to submit a question at any time. Up next, we have Darlene has asked a question. Darlene's question is, are the hospitals working on combining MyChart results with other hospitals and family doctors so it's all in one central place?
Darlene, that's a great question, and that certainly is the long-term vision for what we hope to achieve. I will say that we're doing that in stages. So certainly within the hospital, as I said, our electronic medical record is an end-to-end solution, and that basically means that from emergency department through all of our inpatient units, our surgical programs, our day programs, patients are all connected on the same health record, and you will see your results in MyChart. In terms of our community, we have created linkages with the first place we started was creating linkages with our long-term care homes. So we have 10 long-term care homes that we support. We often see patients who come to us from those homes. So we created electronic linkages so that we're able to see patient information at their long-term care homes as well as when they come into hospital. We next created linkages with our partner hospitals in York Region, Oak Valley and South Lake. Often we share patients amongst those 3 hospitals for various reasons, and so they're now able to also access information in our electronic health record as well as we're able to access the results of tests and procedures for patients who come to us who have been cared for at either one of our partner hospitals. And then lastly, this year what we're starting to do is work again with our primary care network through a program called HealthLink to start to give them access to be able to see specialist results and information for patients that they care for that are also patients of Mackenzie Health. So lots of information there to say that we are definitely on a journey, and the vision is absolutely over time to have an interconnected medical record where you have all of your information centralized and all of your care providers will be able to see that. It takes time, and we are doing that in a very purposeful and staged manner.
Darlene, thank you for that question. Again, just a quick reminder for everyone joining us, we do want to hear from you. Press 3 on your phone's keypad if you'd like to submit a question at any time during the telephone town hall this evening. So again, simply press 3 on your phone's keypad to submit a question. Someone will take your name, where you're calling from, and your question. Next, we have a question from Clara. Clara's question is, previously, Mackenzie Health had the Shaw Clinic operating. During the pandemic, her family experienced a lot of depression. Are they planning on getting it up and running again, or providing similar services for the public at large?
Yes, thank you for that question. And we did move to remote care during the pandemic for sure, but that is over. And I'm happy to say that the Shaw Clinic is open and it is accessible for patients. It is treating patients actively, and we have quite a few outpatient mental health services that are available for our community. I will say, though, that is one area where we continue to see high demand. So while, as I said earlier, we opened an additional 20 mental health inpatient mental health beds, which was much needed for our region, we still continue to see high demand for mental health care services in our community from an outpatient perspective. And so we're looking to see what we can do to improve that, working collaboratively with other partners, such as the Centre for Mental Health Services in Western York region. So thank you for that question, but the clinic is open and available for patient care.
Clara, thank you very much for that question. Again, a quick reminder to everyone joining us, we'd like to hear from you, your questions. Press 3 on your phone's keypad to submit a question at any time. Now, for those who may be just joining us now, members of Mackenzie Health's leadership team have already provided an overview of the programs, services, and current state of operations at Mackenzie Health, including an update on current emergency department volumes, planning for respiratory virus season, how Mackenzie Health is addressing the surgical backlog to ensure patients get their procedures done as soon as possible, and Mackenzie Health's plans for the future. If you would like to listen to a recording of the full telephone town hall, please check Mackenzie Health's website next week. Now, let's welcome David Stolte, Executive Vice President of Strategy and Clinical Support at Mackenzie Health, to provide an update about growth in the region and how Mackenzie Health is planning to meet your future health needs. David?
Thanks, Eric. Earlier this evening, Mary-Agnes touched on the importance of looking ahead, and I'd like to talk about why planning for the future of healthcare in Richmond Hill isn't just important, it's urgent. Mackenzie Richmond Hill Hospital is over 60 years old. It's aging and in constant need of repair. While we've made upgrades to the building, like refreshing corridors, several patient care units, and washrooms, updating sprinkler systems, and replacing our generator, these are temporary fixes. They help us today, but they won't meet the demands of tomorrow. Our community is growing fast. By 2041, the population of the communities we serve will increase by an amount larger than the entire population of Richmond Hill today. That's like adding a whole new city to our region in 15 years. It's not just growth, it's aging. People are living longer, and with age often comes complex health needs. Seniors require a different level of expertise, more time, more coordination, and specialized training. Right now, 70% of our inpatients are over the age of 65, and that number will only rise. That's why we've launched a senior strategy at Mackenzie Health, as described by Heather earlier. We're training our staff to better support older adults and designing care models that focus on dignity, independence, and safety. This is how we're setting ourselves apart, because caring for seniors isn't just part of what we do, it's central to our future. But to truly meet the needs of tomorrow, we need to start planning today. Carlucci-Vaughan Hospital took years from concept to opening. If we wait, we risk falling behind. This isn't just about infrastructure. It's about making sure people in Richmond Hill and across Western York region can count on their hospital when they need it. As we continue our planning for the future, we promise to bring you along on our journey to make sure your thoughts, feelings, and insights inform our work. And that's what we're doing. Last October, we launched our Mackenzie Health Cares campaign to better understand what matters most to you, what you need now, and what you'll need in the future. And you've responded in a big way. More than 22,000 people have engaged with us through our survey. Here's what we heard. 97% of residents who took the survey are worried about the future of healthcare, and more than half are very concerned. That tells us planning for the future isn't optional, it's essential. We've already started acting on what you told us. We're advocating for a two-part solution to help address the capacity and space challenges we're facing. First is activating 2 shelved floors at Carlucci-Vaughan Hospital. When the hospital was built, we worked with government to plan ahead and prepare for future growth. 2 additional floors, making up 116,000 square feet of space, were constructed but left unfinished, what's known as shelved space, so that they can be quickly completed when the community needed more capacity. Well, that time has come. We surpassed projections far sooner than anyone had anticipated, and these floors need to be activated now. At our peak last year, we had more than 100 people admitted to the hospital and waiting in the emergency department for a bed to become available. We were so full that we were actively preparing to set up the auditorium at Cortellucci Vaughan Hospital to care for patients. Our short-term solution to ease these pressures is to complete the shelved floors at Cortellucci Vaughan Hospital and add 149 beds to the system in just 24 to 30 months. That's the size of a medium community hospital that we can add to the system in just a couple of years. And we can do that at a fraction of the cost and the time it would take to complete any one of the new hospital projects that are already underway in other communities. This is a cost-effective solution that will swiftly alleviate current capacity pressures in our region. I want to take a moment to congratulate our colleagues at Halton Healthcare. They recently received government approval to complete the shelved floors at their hospitals in Oakville and Milton. This is a smart, forward-thinking move that will help ease pressures in Halton region and benefit residents there. Their success shows what's possible when we plan ahead and act decisively. We share the same vision and the same need here in York Region. Activating our shelved floors at Cortellucci Vaughan Hospital is the fastest, most cost-effective way to add significant capacity to the system, and we're ready to move. We're continuing to work closely with our provincial government partners to make this happen because our communities can't wait. The second part of our solution is to secure a planning grant to begin the long-term work of redeveloping Mackenzie Richmond Hill Hospital. Here's the reality. Cosmetic improvements keep it safe and operational for now, but without modernizing its infrastructure and expanding its footprint, we won't be able to meet the needs of our growing and aging population. This is about more than bricks and mortar. It's about making sure people in Richmond Hill, Vaughan, and King can count on their hospitals to be there when they need them most. So how can you help? Stay informed, stay engaged. You can visit mackenziehealthcares.ca, that's mackenziehealthcares.ca, to sign up for updates and learn how you can advocate for what this community needs and deserves. Together, we can shape the future of healthcare, because Mackenzie Health cares, and so do you. Eric, it's time we can go to our final polling question.
Thank you very much. We have another polling question now. So again, using your touch-tone phone, you can indicate your response on this question. You've heard about our proposed approach to address capacity and space pressures, preparing 2 unused floors at Cortellucci Vaughan Hospital for patient care, and beginning long-term planning for Mackenzie Richmond Hill Hospital. Would you be willing to sign a letter of support that will be shared with the government? If yes, you would sign a letter of support, press 1. If no, you are not comfortable signing a letter of support, press 2. And if you are not sure, press 3. So again, you've heard about our proposed approach to address capacity and space pressures, preparing 2 unused floors at Cortellucci Vaughan Hospital for patient care and beginning long-term planning for Mackenzie Richmond Hill Hospital. Would you be willing to sign a letter of support that will be shared with government? If yes, you would sign a letter of support, press 1. If no, you are not comfortable signing a letter of support, press 2. If you are not sure, press 3. Now, for everyone just joining us, we have been hearing from Mackenzie Health leaders about how they're working with you, members of our community, to plan for the future of healthcare. Through the Mackenzie Health Cares campaign, they are listening to your concerns and turning them into action. So together, we can make sure care keeps pace with the needs of our growing region. We're now going to answer a few more questions from the audience and share some comments from the community. After that, we'll welcome back Mackenzie Health Interim President and CEO, Mary-Agnes Wilson, to say a few closing remarks. So we're going to go to a few more questions from the people listening in. Once again, a reminder, press 3 on your phone's keypad if you'd like to submit a question. First is a question from Ali. Ali's question is, does the hospital serve halal meals for patients that are admitted at the hospital?
Thank you for your question, Eric. I'm going to ask David Stolte to take that question.
Thanks very much for the question about halal meals. And pleased to say that the food service delivery at Mackenzie Health is very much in keeping with the cultural needs of the community. We do offer a food preparation on site with professional chefs as well, and have many different meals to meet different needs of the community. So halal meals, I can confirm that halal meals and halal options are available through our food service for patients at our hospitals, at both hospitals.
Ali, thank you very much for your question. Again, just a quick reminder to everyone joining us, press 3 on your phone's keypad if you'd like to submit a question. Next, this question comes from Gaetano. Gaetano says, can some of the patients from Corlucci Vaughan Hospital go to Mackenzie Richmond Hill Hospital?
Yes, Eric, thank you for that question. Thank you, Gaetano. Yes, patients from Corlucci Vaughan can go to the Mackenzie Richmond Hill Hospital, and the Mackenzie Richmond Hill Hospital patients can come to the Corlucci Vaughan Hospital. So patients do go back and forth depending on the services that they need.
Gaetano, thank you very much for that question. Again, submit if you'd like to submit a question on the town hall this evening, simply press 3 on your phone's keypad. We have our next question coming up from Pezza. Pezza's question is there anything for us patients to do to help with the burden at the hospitals? What kind of items like paperwork should the patients bring with them to the hospital to help the hospital know what the issues are?
Yeah, thank you. Thank you for that question. So I think as patients, certainly when you come for care, it's always important that you come with a full knowledge of what your medical conditions are, a list of any medications that you're taking, any allergies or anything that you need us to know in order to prepare to help us care for you. So that's really important information that you share with us. But I think as a community, hearing about some of our challenges and concerns, I would encourage you to certainly become part of our Mackenzie Health Cares campaign. Log on to our website, learn about the challenges that we're facing, and learn about what you can do to help us from an advocacy perspective. So thank you for that question.
Yes, thank you very much, Pezza, for that question. Now, this is a question, the next question we're going to go to, and again, if you are listening and you'd like to submit a question, simply press 3 on your phone's keypad. This question actually came in from Peter by email. Peter emailed in a comment and a question ahead of time. He says he's had numerous interactions with the hospital over the last few years, and he wanted to note he's seen an improvement in the efficiency of daily operations in the areas he's visited. He also noted the super friendly faces of staff everywhere. And now for Peter's question, he says, we know the community is growing quickly and the hospital is under pressure. Which departments are feeling it the most? What's being done to manage that? And what could it mean for patients, like longer waits or being sent to another hospital?
Yeah, thank you for that question, and thank you for the compliment. I'm going to ask Heather Stewart to talk about how we manage patients on a daily basis.
Yeah, thank you so much for the compliment that you've seen an improvement. We do always take feedback and bring it to the frontline physicians and staff to see how we can make improvements. We're always trying to be efficient within the emergency department and manage patients that are arriving. One of the other pressures that we see within the emerge that we had talked about is the number of patients that are arriving that are quite ill that need to be admitted. Those patients at times spend extended lengths within the emerge, and as Mary-Agnes and David shared, that we do have shelved floors that could be built out over the next 2 years that would support future expansion and accommodation of those patients. So advocacy and signing up for Mackenzie Health Cares will provide you with updates on that. But thank you for the question.
Peter, thank you again for submitting that question. Again, a reminder, if you'd like to submit a question, simply press 3 on your phone's keypad. Someone will take your question and where you're calling from and take your name as well. We're going to go to another question. Virginia asks, Well, Virginia's question is she would like to know how they plan to train nurses and registered nurses in dealing with patients who are dealing with dementia, including rehab. Her father did not receive the attention that he required unless Virginia advocated on his behalf.
So thank you for that question. And I'm going to talk about a couple of initiatives that we have in place. We have created a specialized unit that we call our Behavioral for Acute Care of Elders unit, or BACE for short. That unit is particularly dedicated to care for seniors who are experiencing an acute medical episode, so they're quite sick, need to come into hospital, but they also have Alzheimer's or dementia or some other kind of cognitive decline. And so you can imagine that it's very frightening for those patients. It's concerning for their family members, and for the staff. They need to learn how to best care for those patients and to have them in an environment that supports their care. So in our BACE unit, it is designed specifically to care for those kinds of patients. The care delivery model there, the staff are specially trained. The environment is specifically designed to support seniors with dementia. And we do, I would say, a very good job of stabilizing those individuals, and oftentimes they're able to go home, back to their retirement homes or back to their long-term care homes effectively. But outside of that unit, as you heard Heather speak about our senior strategy, we're taking a very proactive approach to the care of seniors throughout our entire organization. And so that has resulted in designing a very highly specialized education and training program for our nurses. And they've participated in that program. We started with some pilot units, and we were rolling that out through the entire organization. And so I'm sorry to hear that your experience in the rehab department was less than you had hoped, but I will say that this is a situation that, as we see more and more seniors with higher rates of dementia and delirium, that we are taking very seriously, and we have a proactive strategy in place to address this in the future.
Virginia, thank you very much for that question. Again, a quick reminder, if you're joining us and you'd like to submit a question, please press 3, and someone will take your name, take your question, and where you're calling from. Now, up next, we have a question from Niger, who is, their question is, I apologize, their question is, they would like to know why the hospital does not hire social workers for psychotherapy, and what professionals support mental health patients.
So thank you for the question. We do have an interdisciplinary team of a variety of different care providers. So obviously psychiatrists, but we also have a nurse practitioner in psychiatry. We have a clinical nurse specialist. We have nurses. We do have social workers. We have a variety of other individuals who work in the mental health department. And the approach is to provide really that interdisciplinary team and provide a more of a comprehensive approach to care. So it's not about hiring one particular care provider. It's about understanding the population of patients that we have and how best to address those needs. Thank you.
Thank you very much for that question. Up next, we have another question. This one came in from Nadia. Nadia's question was, they want to know why the hospital, I apologize. Nadia's question is that they would like to thank Mackenzie Health. They went to the ER 3 times and was treated very well.
Well, thank you for sharing that with us, Nadia. And I know we've spent a lot of time talking about the challenges that we have in our emergency department, but we do want our community to know that we are doing our every utmost best to ensure that people who come to us in need have their needs met.
Thank you again, Nadia, for sharing that with us. Now, Mary-Agnes, we have actually, we're just about reaching the end of the town hall. With the last couple of minutes remaining, did you want to share a few final thoughts or concluding remarks with the listeners?
Yes, Eric, thank you so much. First of all, I really want to extend gratitude and thanks to our community for all of your support for us as an organization, and thank our government partners as well for their continued support for us along the way. It does take a village, and we're all in this together, and we certainly feel that support, but we continue to advocate for what this community needs and what our organization can do to ensure that everyone gets the care that they deserve. Beyond that, I want to thank all of our listeners and thank you for joining us. And I also want to remind you that if you missed any of this evening's telephone town hall, we will be posting a full recording to our website next week. And to share your thoughts and be part of planning for the future of healthcare in our community, as I've said a couple of times, please visit mackenziehealthcares.ca to share your thoughts with us. You can also reach out to us on social media or by email at publicaffairs@mackenziehealth.ca if you have any questions. And again, thank you so much for joining us tonight. And back to you, Eric.
Thank you one more time to everyone for joining us this evening. And remember to listen to a recording of this town hall, which will be posted next week. Please visit the Mackenzie Health website, which is www.mackenziehealth.ca. You can also email questions, concerns, and feedback to publicaffairs@mackenziehealth.ca. Thank you again for joining us this evening, and have a great night.